So it's an enormous pleasure to attend this meeting on sudden cardiac death here in Prague, sponsored by the Menarini Foundation. The subject of my talk today was sudden cardiac death in patients with cardiomyopathy, an important issue for the many patients that have heart muscle disease of many different kinds. The messages I was trying to get over today was that although this is a relatively uncommon event, by adopting a systematic approach to clinical evaluation and risk stratification, we can identify a subgroup of patients who benefit from prophylactic therapy with defibrillators. However, I also wanted to make the point that to make further progress in this very difficult area of risk prediction, we need to start adopting new strategies. And one of those strategies that I proposed today was a move towards personalized diagnosis. Because it's very clear that patients with hypertrophic cardiomyopathy or dilated cardiomyopathy have their prognosis determined not simply by the morphology of their heart, but also by the underlying etiology. And as we move into a new omics era where we're using genomics as well as protein markers, metabolomics, we're starting to stratify patients into ever more precise risk groups. I think on a wider front, the meeting provided us with insight from both the basic science, epidemiology, and clinical practice. And I think this is yet another example of the good work that the Foundation does in bringing education to cardiologists of all levels of seniority and experience.